Ozempic, semaglutide, can leave a tiny drop after a shot, and that drop does not always mean your dose leaked. The risky move is guessing. If you repeat the shot, a small technique issue can become a side effect problem. This is a safety call, not a willpower test. The decision starts with the dose counter and leak pattern. Many people panic because the skin looks wet. Wet skin alone is not enough evidence. The same wet mark can come from leftover liquid, early needle removal, or a pen that did not finish. That is why the counter and timing matter more than the size of the wet spot. The safest first answer today is to pause, not repeat, and check the pen, needle, timing, symptoms, and counter carefully first. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Ozempic is injected under the skin, not into a vein or muscle. The pen pushes medicine through a tiny needle into the tissue under your skin. Medicine needs time to move through the needle and into that tissue. That is why the counter, needle position, and hold time matter. If the needle comes out too early, pressure can still push medicine out of the tip. A tiny bead after removal can be different from liquid running during removal. Running liquid suggests medicine may have escaped before the dose finished. The bead may simply be leftover liquid at the needle tip. Here is the useful split. If the counter reached 0 and you only saw a tiny bead, an extra shot is usually not needed. If liquid ran out as the needle came out, call before repeating. If the counter never reached 0, treat it as a possible device problem. That split matters because the actions are not identical. A finished counter plus a tiny bead usually means watch, document, and continue unless you were told otherwise. Running liquid means the dose is uncertain. A stopped counter means the pen or needle may need troubleshooting. Most people should not automatically repeat the shot. You cannot measure the lost amount by looking at your skin. You might have lost almost nothing, or you might have lost part of the dose. A full second dose could be too much. If the pen was dropped, damaged, frozen, or hard to turn, mention that immediately. Device problems are handled differently from normal technique mistakes. The staff may ask for the pen color, remaining medicine, or package information. Do not throw the pen away before you get instructions. If the medicine looks cloudy, discolored, or has particles, do not use that pen until you ask. A strange-looking pen is not the same as a normal tiny drop after injection. That is a quality issue, and it belongs in the call. You may not be able to fix the problem yourself. A partial injection is not like spilling a pill on the floor. The medicine may already be partly inside your body. Guessing a rescue amount can create a second error. Too much Ozempic can mean more nausea, vomiting, diarrhea, dehydration, or stomach discomfort. For people with diabetes, the risk also depends on other medicines. Insulin and sulfonylureas, a class of diabetes pills, can lower blood sugar directly. A repeated dose may cause side effects and sometimes low readings. That is why the answer should depend on your actual medicine list. If you use medicines that lower blood sugar, follow your clinician's blood sugar plan after a dose problem. If you use a weekly weight loss injection, the same repeat dose caution still applies. Missing part of one dose is usually less dangerous than stacking medicine without guidance. Safety beats perfect weekly timing. The goal is not to rescue the dose by guessing. The goal is to prevent a second mistake after the first uncertain one. That is why the safest move is documentation, not improvisation. Write down the dose, the time, the injection site, and what you saw. Note whether the counter reached 0. Keep the pen available if possible, but do not reuse the same needle. Then call the prescriber, pharmacist, or product support line if the dose is uncertain. The question is not only whether medicine was wasted. The medical question is, what is safer today, waiting or repeating? That answer can change with your dose, diabetes medicines, symptoms, and blood sugar pattern. When you call, use concrete words. Say, tiny bead, wet patch, running liquid, or counter did not reach 0. Say whether you counted before removal. If someone helped you inject, include what that person saw. A clear story prevents unsafe advice based on panic. While waiting for advice, do not use the missed dose rule as a shortcut. A missed dose has a calendar rule, but a leaked dose is a delivery question. One asks when the next weekly dose belongs, the other asks how much medicine entered your body today. A tiny drop after a completed injection usually means you should not repeat the dose. Running liquid after early removal means you should call before repeating. If the counter never reached zero, treat it like a device problem. These are starting points for the call, not a replacement for medical advice. Feeling very weak, confused, faint, or unable to keep fluids down makes the call more urgent. Bring the pen details and glucose readings into the call if you track blood sugar. The clinician or support staff needs facts, not guesses. That makes the advice safer and faster. Symptoms can guide urgency, but they do not prove the dose. No nausea does not mean the shot failed. Nausea does not prove the full dose went in. Side effects vary by person, meal, hydration, and dose level. Do not use symptoms as your measuring cup. Before the next injection, choose a site you can see and reach. Sit down if you usually rush, and use good lighting. Keep your fingers away from the dose window. If you cover the counter, you may not notice that the injection stopped too early. Then slow down the actual injection. Attach a new needle, check the medicine looks clear, and make sure you can see the counter. Press and hold until the counter reaches zero. Keep the needle in while you count slowly, then remove it straight out. If your hands shake, ask someone trained to watch the counter. Do not let them push the button unless they know the device. The goal is simple: one steady press, one visible counter, and one slow removal. Rushing a weekly injection can turn a simple task into an uncertain dose. If this happened during your first few injections, ask for technique review. Many dose problems are not from the medicine itself. They come from hand position, pulling out early, or losing sight of the counter. A short demonstration can prevent repeat mistakes. Do not chase a perfect-looking injection. A small drop, a tiny blood spot, or mild stinging can happen even with correct technique. Good technique does not mean the skin always looks dry. It means the counter finished, the needle stayed in, and no liquid ran out. Do not rub the injection site afterward. Press lightly with gauze or cotton if there is blood. Remove the used needle and dispose of it safely. Leaving a needle attached can increase leakage, contamination, blocked needles, and wrong dose problems later. The bigger lesson is control. Watch the counter, keep the needle in, and avoid a second shot without guidance. A leaked dose is a reason to slow down, not a reason to gamble. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.